My name's Captain John Greensmith. I'm a A&E nurse here in the British Army and back at home in the NHS as well. I'm out here on exercise Haraka Serpent. It's a multifaceted exercise, so the clinical engagement exercise that we've got here at the moment is coming out to local communities, setting up with a charity called Beyond Zero, and coming out to local environments, local communities, and providing healthcare alongside Beyond Zero.
So Beyond Zero, we call it a hospital on the wheel, or healthcare on the wheel, because basically what we do at the community level is get to the areas that are hard to reach, areas that are vast in Laikipia County, where the facilities are distance apart, and we get to the community to give them integrated services from primary health care to reproductive health, HIV testing, nutritional assessments, curative and health promotion to the community areas and the marginalized areas of Laikipia County.
Today we've visited one of the schools, and our gynae nurse and our two midwives, with the assistance of some of the Kenyan healthcare professionals. What we've been able to do today is educate some of the secondary school young girls with regard to personal hygiene, sanitary products, sanitary wear, how to use those effectively, how to use those safely. And then we also spoke about them being safe, and with regard to their relationships with boys, and what is accepted behaviour and what's not accepted behaviour.
Hi, my name is Christine Duffy. I am a major in the British Army, 202 MMR, and I'm here as the Community Engagement Liaison Officer. I'm originally from Kenya. I was born here, grew up here, went to school here, did my nursing training here. I felt that I've got more to offer in terms of advising and guiding the troops in understanding the local culture. So the diseases we see here in Kenya, some of them are not different to the diseases we would see in the UK. For example, we're seeing a lot of skin conditions, a lot of sexually transmitted diseases can be attributed to the polygamous nature of the community. And obviously there's a lack of screening because the women would not go for screening, therefore these conditions are not picked up and treated earlier. So the women's health teams are facing a lot of FGM. FGM stands for female genital mutilation. So that's where they have their labia sliced off. It may be all of them sliced off and stitched up, which makes it very difficult when they're having a baby. It can be very traumatic because the opening is all stitched up. So when they end up doing any screening, they are finding very advanced cervical problems, which they cannot confirm whether it is cervical cancer because we cannot test, and they will not go for testing because they have to pay for the test, for the actual screening test. So very difficult situations that they are facing. Yeah, so in terms of medication and making sure that the teams have appropriate medication. Previously, we would just come with lots of medication from the UK, but that caused problems because the formularies we use in the UK are completely different, which would cause problems if you're given a prescription and they cannot get the same drug. Therefore, working with Beyond Zero, for example, and the Samburu leader, they've identified the drugs they need, they've ordered the drugs, we have paid directly for the drugs, they've been delivered directly to the appropriate teams. Any medication that's not utilized during the camp here remains in the clinic and they can use for future camps, or they can continue to use during their daily patient care.